All right, everybody. Again, thank you so much for being here with us. Let's go ahead and get started with today's webinar. Today, we're going to be going over the patient portal, guys. Title of today's webinar is Empowering Clients, and I'm going to be showing you guys how to support your clients through their patient portal journey. All right. As I mentioned before, guys, it's not just going to be me here today. I also have somebody from our team. His name is Louis. He's going to be helping me out throughout today's webinar to make sure we answer your questions. My name is Marco. I'm going to be your host. We're both customer success managers here at Carepatron. If you guys have reached out through the Help Center, you might have already had a chance to get to know either one of us. But yeah, I'll talk a bit more about that Help Center for you guys by the end of today's webinar, just so you know where you can go ahead and reach out to us if you have any questions or if you need any assistance from our part, okay? Alrighty, guys. So as I said before, we're going to be taking questions throughout the webinar, but I want to make sure you guys know exactly where to share those questions. So if you notice the options at the bottom right corner of the calls page, you'll see you have a couple of options. One of them is like an icon with 3 shapes on it. It's called Activities. Go ahead and click on that. You'll notice you have the Q&A section right there. That's the third option here on that list. Click there, and you'll find Louis. Go ahead and ask your questions. Louis will be answering those questions throughout the meeting today. Okay, so what are we going to be visiting today? We're going to be going over the patient portal, but I want to make sure you guys know exactly what the experience that your clients are going to be having when you guys, add them as a new client to your Carepatron workspace. All right, so I'll be showing you guys what it is to, log in for the first time, as well as receiving intake forms, default intake forms from your Carepatron workspace, and how the clients can fill those out. Now, inside the patient portal itself, we're going to be taking a look at the dashboard. We're also going to be seeing how patients can interact with the documentation you provide, as well as how they can add documentation and notes through the portal as well. I'll be showing you guys the relationship section, as well as how the patient can change their settings. Now, the point of today's webinar is to make sure that you guys know how to provide the best information for your clients as they interact with the patient portal. Now, you guys are the ones with access to our Help Center. Since clients are more in contact with you guys and are not really knowledgeable about what the workspace does, in depth as you guys and your team do, since they just have access to the portal, you guys are the best source of support for them. So that's why we want to make sure that you guys know how easy it is for the patients to interact with the patient portal and how you can provide that support to them, okay? So without any further ado, guys, let's go ahead and take a look at the welcome email your patients are going to be receiving after they have booked online. Okay, so let's go over to the inbox. There we go. So as you can see right here, guys, we have the email that I received right after I booked an appointment online. It says, "Welcome to Carepatron Webinars." That's the name of today's workspace that we're going to be working with. My name is Marco here. So it says, "Hi, Marco. The practice would like to provide some information and review important documents. Please follow the link below to get started." Now I have both this button here and this link down here to start with the intake process. So let's go ahead and take a look at that. Let's give it a quick second. Alrighty, so sorry about that, guys. My internet's being a little bit slow, but that's okay. We'll go ahead and get started shortly. There we are. Let's come over here, and there we are. Let's go ahead and complete the intake first. Some personal details. There's already some information in here. I'll go ahead and just select a random date of birth here. My number is, there we are. My email's already there. Gender, I'll go ahead and say male. Language, English. My time zone. My address, I'll just go ahead and choose this. And that's it. There we go. After that, your clients have a chance to add any documents that they need to from the start. So if you need any piece of information, maybe they're being referred from another doctor, you want to make sure that they provide all those documents, all that history that they have with the other doctor, because it's pertaining to what you guys are going to be providing. This is where they can go ahead and add that information. They also have a chance to add a bit more information for you guys as context, and a bit of a description for the files that they're going to be uploading here. Now, here are the intake forms. Guys, remember, if you guys have joined our weekly Mastering the Basics webinar, you guys know you can go ahead and set default intake forms for any new clients when they go through, this original online booking and their first experience with the Carepatron patient portal. So let's go ahead and finish these up quickly. Let's go ahead and say there, Marco. Oh. And then let's finish this out today. Yep. Already my signature here. Just let's do that there. Date, it's today as well. And then the other signature over here. That's done. And this is today. Now, this is just one of the many templates that we have, guys. Don't pay too much mind to what we're seeing here. Document wise, it's more so you guys know what the experience is actually like. So in here, we have a form where patients can go ahead and add information directly through, a calendar selection, but also we have the option for you guys to add a signature section where you or the client or both, in this case, are able to add your guys' signature. Okay, so there we go. I am done. Let's submit that. There it is, complete. Now let's go to the next one. Again, Marco. There we are. Now it's super important, guys. You might have noticed I'm breezing through these. I'm being able to add the information and interact with the sections without any issue. One thing you're going to be encountering sometimes is people will change from responder over to viewer, and that doesn't allow them to do anything. So they'll probably reach out and be like, "Hey guys, I can't fill out the form that you guys have, as my intake. What can I do?" First thing to take a look at is how they're viewing the intake form itself. If they're seeing it as a viewer, make sure they turn over to responder, and that way they'll be able to continue answering the question. So let's go through it really quickly, guys. There we go. There we are. This is a great experience so far. There we go. These are not, you might have noticed, guys, there's also forms that we've created that have like information that the client needs to provide in order for the intake form to be submitted. So you might have noticed this asterisk here. That's what it means. It means you need to add that information in order for the form to be submitted successfully. In this case, just to save some time, guys, let's go ahead and submit that already. There it is, in progress and complete. So this is basically the way that the clients can go ahead and take care of intake forms from the start, add the information that you guys need in order for their profile to be completely filled out in your workspace. And it's as simple as just doing this right here, clicking on filling it out, going over to the document itself, adding the information and clicking submit. Okay. Let's go ahead and finish these up. Patient name Marco. Oh, that's okay. Let's go ahead and say 30. And it's going to be your mail. There we go. And signature again. Done. Today. Submit. And you might have noticed, since I haven't completed all the forms that I have here for intake, the system didn't allow me to continue to the next step. So I just want to make sure you guys knew our system is also designed to make sure that your clients are able, to fill out those intake forms and not skip any of them when they're going through the initial process. So last but not least, we have this one right here. This one doesn't have any necessary information. So let's, just for time's sake, let's go ahead and complete that. And there we go. Now, since you have billing through the Carepatron workspace and the possibility to collect payment through Stripe, the system will ask for a payment method. At this time, if they don't want to go ahead and add a payment method, you'll notice this is not obligatory. There's no asterisk there. So if you ever go through, if your client ever goes through this process and they're like, "Hey, I don't want to add my card," just tell them that's okay. Just click next, and you can go over to the next section. Okay. Now this is the part where they'll be creating the password for their patient portal. Okay. So I'll go ahead and choose a password. Let's go for, yeah, there we go. Just quick one there. Oh, that's it. And we're done. Alrighty, so now I can go back to my email. Let's refresh this page here. And here we are. I got my code here. Confirm. Now I can go ahead and log in there without a problem. So let's go ahead and do just that right here. Sign in. And let's save that. So there we go. Now I'm in the patient portal. Okay. Now that I'm here, guys, you'll notice this is kind of a similar version to the workspace that you guys are going to be working with, but it's much more simplified. There are many less options in here for the patient to use and tools, unlike your guys' workspace. Okay. So first and foremost, the patient is going to be brought to their dashboard. From here, they'll be able to see any upcoming appointments, but they also have the chance to book another appointment. Okay, in this case, let's go ahead and book an appointment right here, just so you guys can see exactly what happens. They are brought over to this quick interface where they can select the workspace that they want to book an appointment with. And there we go. So they go through the motions of scheduling that online appointment. There we are, scheduled for today, and continue. That's right. That's my info. Confirm appointment. Done. Okay, so I just confirmed my appointment. And if we come back here, guys, over to the workspace again, over to the portal, sorry, let's refresh the page and we'll see that upcoming appointment right there. Now from here, the patient can go ahead and join a telehealth call if the service that they requested offers that option or is located, like the location assigned to that service is an online call. They can go ahead and join directly from here. They also have the option to book this again for the future. So again, let's go ahead and take a look at that together. Here we are. It'll bring them directly to the time selection and day selection. So I'll say, you know what, I want to book this for next week at 1 p.m. Continue. There we are. And confirm the appointment. So again, we come back here. Let me go ahead and quickly refresh the page. And there we see the next week's appointment. Okay. Now there's a bit more information for them, such as the service that's going to be provided, the charge for the service that they requested the appointment for, and like I said, just more information about them, the service provided, and the date and time when this is going to be held. Okay. It's super simple, really easy for them to know what's coming up, you know, where to go if they need to join a call, a telehealth call. It's right here. Okay. Now, the next section is documentation. From here, they have a chance to directly create notes, but you'll notice right away we have those intake forms that they already submitted from the start available to them right here. Okay. So they can take a look at what they already submitted for them. If they need to, they can download this file directly from here and they can save it as a PDF in their system. Okay. Now, in here, they can come back and change the responses at some point if you're like, hey, you know what, I think you had a typo or the information in there is not exactly right. For example, here, let's say this exactly happened where it says the age says 30, but you know the date of birth doesn't match that exact age. Tell them, hey, go back to that intake form, please, in your portal, change the view to responder, and go ahead and change that. Alrighty. So it's not like set in stone when they submit those forms at the start. Now, from here, they can also upload files, as I was mentioning, guys. They could just go directly into their files, upload whatever it is that they need. And also, they can create new notes directly from here. Now, they don't have access to your templates, guys. They just can create notes that are like, I would call them freehand, where it's like if they want to communicate something with you guys, or if you want to, what we've had while we create the new chat feature that's going to be coming up in a couple of weeks within the workspace. While we finish that up, you guys can set up a note with the client where you can tell them, hey, if there's anything you need to let me know that you want to keep in the Carepatron patient portal, just go ahead and add it to this note. You guys, as a practitioner, will have access to this note through their documentation section in their client profile in the workspace. Okay, so I don't know, let's call this patient news. And let's say, hey, today, it's 26, 27. Oh, and there we go. So today I was feeling, you know, that way when they click complete, it's right there. They can always come back and add more information, maybe tomorrow, you know, update the information, you know. And like I said before, when they save the changes, you'll see those updated pieces of information in your in your Carepatron workspace as well in real time. So as soon as they hit save, both the patient portal and your Carepatron workspace will be updated with the newest information within the file. Okay. Now the next thing is relationships. Now, if you guys remember, you guys can add people that are not necessarily clients of your workspace. They can be clients, but most of the time it's people that are not clients because they're just related to the client themselves. So in here, they'll be able to see who they are related to within the workspace. So give me one quick second. And alrighty. Sorry about that, guys. So as soon as they have a relationship available, they'll be able to see it right here. There's not much they can do when it comes to like changing the relationship information or anything like that. You guys have control over the information that's added for the contact. If you want to change any pieces of information for the contact, you do that directly through the Carepatron workspace. I'll go over that in a little bit, guys. Just before we end today's webinar, I'll make sure you guys know how to change contact information. But yeah, it's just so your client knows I have my contact here available in the portal, and also you can enable that contact access to this portal, so they'll have access to the information such as the documentation and the dashboard as well. Okay. Now next is settings. Now this is for the client's personal, experience when using the portal. They can change the information in here, their name, their last name. If they want to change their email address, they can do so. This information, again, will be automatically updated in the workspace as well. They can change their phone number. If they need to change their password, they have the option right here. They can change the language. It happens a lot of the times that the client might speak another language as a native tongue. So we have the option for them to do that directly there. Okay. All righty. So let's continue. Alrighty. So you can also set up a multi-factor authentication option. This would need to be an outside profile or tool for that multi-factor identification. Just so you guys know that they could go ahead and set that up directly here, and make sure that there is no issue with that. Give me one quick sec, guys. There we go. Now they can also go ahead and delete their account if after a certain amount of time, you guys, there's no need for them to come back. We don't recommend that they do this. We don't recommend that you guys tell the patients to delete their account at any point, just to make sure that you guys have that information available in case you need it in the future. But yeah, it's as simple as just coming over here and deleting the account by clicking here and confirming that deletion. Okay. Now up here, they have a navigation bar where they can go ahead and quickly book an appointment, upload a file, or create a note, as well as this option over here where they can change the profile information, as well as the theme, which is right here, and sign out when needed. All right. Now over here in the payment methods, we have the payment method that they might have added at the time of booking the appointment, but they also have the option to add a payment method at any point when they access the Carepatron patient portal. Okay. So that's basically the portal itself, guys. If you have any, if your clients have any questions about, hey, where can I add my payment, my payment method information? It's coming over to settings, payment methods, new payment method. Maybe the client says, hey, I need to book an appointment for tomorrow, and then I need to book an appointment for 2 weeks into the future, or I want to make sure I see an appointment that I had last week. They'll be able to see it right here. Okay. If they're having any issues with filling out the surveys or the intake forms, and they're telling you, hey, it's not letting me submit the form, remember, make sure that they double check those asterisk questions, because those are needed for the form to be submitted successfully. Okay. Now, remember, guys, you also have the chance to import your templates either by creating them yourself. We're also working on a tool that will allow you guys to just add the templates, and our system will automatically create them for you. But for the time being, if your plan has that feature, you can also reach out to us, and our team will help you out by creating those templates. Okay, guys. So let's quickly come back to the presentation so I can give you guys a bit of a chance to ask any questions if you guys have them through that Q&A section. And I'll show you guys how to see the information for your contacts within the workspace. So remember, guys, if you have any questions, use that Q&A section. Louis will be right there to help you guys answer those questions. So now that we're here in the workspace, I have that service that I scheduled for today, with my client. I can go ahead and say he already attended it. I can go ahead and create the invoice directly from here, which I can send to the client. I can create a note, which will also be shared once I click share right here. Remember, notes are private by default. So if you want to make sure that your client receives this, again, remember, go ahead and send it over to them directly and change the status to the status you need them for that note. Now, when it comes to contacts, guys, as I was mentioning before, you can create a new contact directly from here. Just add, I don't know, first name. Let's go ahead and say Louis Webinars. And his email is this. Oh, a quick sec. And yep, there we go. He has access to my portal. And yeah, let's do that. Let's go over to Louis and see. Let's add him as. There we go. And he's my brother. There we are. Okay, perfect. So now if we come over to my client's profile, we go over to relationships, we have Louis right there. He's my brother. I'll go ahead and just make sure that we see that right there. Save that. And there we go. Now he has access to my client portal. Now he'll be able to see the information that's in there. And, if he needs to schedule another appointment for me for next week because I'm unable to, he has the option to do that. All right. Now, as I mentioned before, guys, in this documentation section, you have those forms that we were taking a look at before. From here, if you guys need to edit any part of them, you have the option to do so. Just make sure you are set up as an editor up here, guys. Okay. All righty, team. One other thing that I wanted to mention, and it has to do with the original sign up, guys, is much like your guys' own login page, they'll have the option to sign in with Google or Apple at the time of logging in after that initial, setup of their patient portal profile and all of that. So if your client has already created a password for their profile, I highly recommend that you encourage that they continue using that. Because in the future, if they need to change the password, they can just go in there and change it directly. If they're using these two features, it's a bit more difficult because they would have, like, if at any point they lose access to their email and they need to change, for the future, to create another email and just be able to access the profile, it'll make it a lot more difficult for them. So one piece of advice that I recommend you guys, I give to you guys, is just tell your patients, if you already created a password, continue using your password. And even further, when prompted by their browser, save that password so they don't have to worry about remembering it. I always recommend writing it down somewhere, just so your clients have that handy. But it's, the best practice is just as soon as you sign in, your browser will ask you if you want to save that password and encourage them to do so. Okay. Now, guys, today's a pretty short webinar, guys, but I do want to make sure that we have time to answer your guys' questions. So I'll come back here to the presentation and let's go ahead and come back.
We do have some pending questions.
All righty, awesome. Let's go ahead and take a look at what we have still pending.
We have Sandra Evangelista. Only offer package pricing. What's the best way to charge upfront if the client chooses to, but not recharge for the future sections in the package?
Oh, great question, Sandra. Let's go ahead and take a look at the workspace together. So the way to do that is by, at this time, while we still, work on that feature for you guys to be able to add packages and memberships or subscription type deals. In the meantime, what you can do is come over to the client and go directly to their billing section right here. So I'll actually use the one that we were using before. There we go. And billing. So the The reason why I tell you to come here is because if they're paying for a package that includes, let's say, 3 or 4 services, and it has an already set price, you can add that price here once you know that they booked that appointment or they want to get that package. And say, let's say it's a $300 package, right? $100 a service. There we go. We create that. Okay. So once I have this credit here, whenever I need to invoice, for example, this appointment here, I'll create the invoice for it.
I don't think you're sharing your screen.
Oh, I'm sorry about that, guys. Thank you so much, Thomas. Let's come back here together. And let's go back to the client. All right, so from the top, let's go over to the client profile, then billing, and then you issue the credit over here. Credit adjustment, you just add the credit as you need it. And it's already right here, so we have $250 in credit. If we want to invoice for this appointment, you know, coming up, when we create that invoice, the system will automatically take from that credit that you already issued. So you'll see right here that it's $50 for the service individually. But since you have credit, the $50 are taken from that credit, and the client doesn't have an amount due. Okay, so that way they don't need to pay for that service because they already paid for it in the package. Okay, now how can you offer the packages for the client to be able to schedule, you know, or for you to know that they need that package? Well, when you create the services, I highly recommend that you add a collection with the services that are included in that package. So you can add the collection name here and say package, let's say maybe number 1, and just select a couple of the services you already have available. There we go. And we create that. So when patients go to book online, they'll be able to see package number 1 includes all of these services. I recommend, you know, if you have like initial service or something like that, just so you give a bit more guidance to the client, because remember, the way that the information is displayed here is the way that the clients will be seeing it when they book online. So just add pieces of information that will make it easier for them to know which one to book first in that package. Okay. Alrighty, Sandra. Thank you so much for that question. I do notice we have a couple more questions. Oh, great question, Sophia. So the way to see the forms that you have already set to default as intake forms is either by coming over to the client list again and clicking on send intake. You'll be able to see all the default intake forms right here. You could just go ahead and, you know, take a look at that right there. Or you can also come over to the template section, and in your team templates, you'll be able to hover over the templates and see which ones are already set to default. Honestly, the easiest and quickest way is through the client section. Even if you're not going to send it out, it'll just give you a view of the intake forms that are already added as default. You can remove them from here. You can even, as you've noticed, like remove the default setting from here. And that way, you know, in the future, if you don't want to go ahead and request that intake form from the start, it's not going to show up anymore. Okay. Great question. Thank you so much, Sophia. Alrighty. Gotcha. That's a great question, Jay, with the, you know, regarding HIPAA. I'll go ahead and write that down and share that information with the team. I don't believe we have something available for that purpose at the moment, but I think it would be really useful for you guys, you know, just to avoid any issues in the future. So, yeah, I'll take that to the team so we can take it into account for, you know, future updates to the portal. Thank you, guys. Thank you, Jay, so much. Alrighty, let's see. What else do we have here?
From Sophia, is there an option for the system to automatically bill?
Not at the moment, Sophia. We're actually working on, you know, still developing parts of the billing section. We just released insurance billing, the first phase of that. So there are new features coming. At the moment, one thing you can automate is super bill generations, especially for our teams in the US. But, you know, billing or automatic billing is not yet available. Okay. But we will be more than happy to let you know when that becomes available, along with the other, you know, future updates. What else do we have here? Lydia, I have students currently building our platform. So it says our Surge 66. Okay. Great question there, Lydia. So the reason why you see that information already like 66% full of the storage is because our system takes every piece of data into account for that storage, not just clients. So if you have any team members in there, any notes, any, you know, events that you've created, any piece of information in the workspace is taken into account for that storage. Okay. So that warning that you have there is just our system telling you, hey guys, you've used this amount of storage. If you want to remove, you know, if you've been using the profile to generate like demo events or demo clients or stuff like that, it's just a way for you guys to know, okay, we need to go in there, delete a couple of them if we're not going to be using anymore, so you don't have that, you know, inactive data there taking up storage for you.
Yeah, the last one is from Yvonne. Can you review the credit card entry to billing sequence for one client?
Quick question regarding that, Yvonne. Do you mean like how they'd be inputting their credit card information at the time of paying for an invoice? Or just adding the credit card information to save it as a payment method within their profile?
We can hear you.
Yeah.
Sorry. Can you hear me now?
Yes, thank
Yeah.
you.
Sorry. Okay, so at the beginning, in the intake process, you said they could skip over adding the credit card information.
Yes.
And so I'm not sure why we would do that. And so, but I was curious if so once they enter that credit card information, just what it looks like from our end to bill the client, just so I can see that sequence.
Of course. So the reason why we don't even like offer like a skip button in that section is because most of the time they will have, you know, they'll add their information right there. That little piece of information I was sharing about being able to skip is just for like, you know, that one-off chance. A lot of practices prefer like cash payment in the office, so they don't really need to ask for that at the time. But yeah, most of our clients will request that information from the start. So I'll go ahead and show you where you can see the client's payment method over here. So when they input that information, since I'm not going to add a card here just, you know, for security reasons, but when they add the information, it'll be found right here. Okay. So give me one quick sec so I can actually pull up one of our demos to see if I have a fake account here with a fake card that I can show you how you can see the piece of information. So basically what you'll see is the way that you can see credit card information in any other platform where most of the card number is going to be, you know, protected, and you'll only be able to see the last 4 digits of the card. And when you generate an invoice, that payment method will appear instead of the option for them to add their card information. Okay. So give me one quick sec, guys. Let me double check to see who we have here. No. Yeah, no, I'm sorry, guys. I don't have one with a fake card here. But yeah, no. I apologize, guys. I don't have one that has an already like set up card just again for security reasons. But yeah, really, it's just as simple as adding that information. It's the same thing. You'll notice like the Stripe portal where they need to add the information is exactly the same regardless of where they're trying to input it. Whether it's directly here, you know, as a new payment method, it's the card, month and year, and the CVC code. Same goes for the, you know, when they're going through that initial sign up, the only other piece of information that's going to ask them is the name on the card. But yeah, it doesn't ask for that here because it's already in the client profile. The system already knows who it's related to. But yeah, it's just as simple as adding the card number right here, and they'll be ready to go. Okay.
Okay, thanks. And Marco, one more question, if I may.
Of course.
The client can delete their account like that. That has like alarm bells going off for me. Why would that be an option for them?
Just in case, like I said before, like if the client is no longer going to be a client of your practice for whatever reason, and you don't want them to have access to that information, or your client doesn't want you guys to continue having access to their information, they can go ahead and delete their profile. Okay.
Okay.
But keep in mind, a lot of people won't go ahead and delete it. We have the 2-step deletion process just to make sure that there's no accidental deletions, you know. But it's an option to have there in case people like sometimes they'll be added without being wanting to be added to the profile. or to the client list in the workspace. So we want to give them a chance to be able to, delete their profile if they're no longer involved with your practice.
But yeah, but that's separate. And I think Louis already answered this, so if they delete their profile, their data with me stays.
Yeah, no, you keep all of that. It's just like if they don't want to have access to the profile, they can just go ahead and delete that. But you have the information, so it's not going to affect your guys' information in the workspace.
Okay, thank you.
Yeah.
I think Sandy had her hand raised. So.
Alrighty. I think we're all set, right, Louis?
Yeah, but I think, and Sandy had her hand raised, so I don't know if she had any question. Okay,
Sandy,
you can answer the other one, which is there an ability to see DSM criteria and super bills?
So in super bills, guys, these are the pieces of information that can be added, like the invoices that have been paid already. You will have information pulled directly from the client profile to the super bill, as well as any information that you want to add regarding yourself or the provider that has to do with this client. You can add diagnoses codes right here, and also the services you provided for the client down here. Alrighty. So as I said before, guys, keep in mind we're still working through a lot of the billing feature, meaning we just released a new phase of billing. So if there's any features there, I'll make sure to reach out to the team and reach out to you guys directly to let you know a bit more of a timeline to when these would be available if they're not right now. Okay. And we have another one right here. Oh, yes, guys. So you can color code the services right over here. So let's go ahead and edit this. We have this color right here. Maybe I don't want it to be red or fuchsia, as it says right here. Let's go ahead and choose blue. That way, whenever this appointment is scheduled, you'll see an event with this color, and you'll know it has to do with that specific type of event. Okay. Of course, Yvonne. So honestly, the experience is more for you guys because you are the ones that interact with the transcribe feature. You're the guys that are going to be using, the AI-powered templates to, summarize and synthesize those transcripts into notes that are valuable to you guys. So the experience that they have is honestly like just a normal call that they're going to be having with you. Our AI at the moment is there for you guys to summarize the information that they provide through a session, as well as be able to, go through it minute by minute and know exactly how the conversation went. There's nothing that changes on their end when they join a telehealth call or when they're using the patient portal. But moving forward, we'll be releasing a bit more information of what we're working on regarding our AI, because we are going to be releasing a really cool feature that is going to be more of an assistant for you guys in the day-to-day, not just a tool that helps you guys only summarize notes. At the moment, that is the capability that it mostly works for. But yeah, regarding the client, there's not much regarding the experience that they're going to be having with it. It's more a tool for you guys in your day-to-day through the workspace. All righty. Any more questions, guys? Anyone else? Now, don't feel pressured to have to ask those questions right now. If you guys have questions moving forward, remember you have the help center right here, where you can reach out to us and ask us those questions. I'm right there. Louis is right there. Just click send us a message, and we'll make sure to send you guys the information that you need. All right. All righty, team. So I think I got one more. Oh, I mean, the AI scribe also works for in-office appointments, Nick. The way that you can use it is you can set it up on your computer, and just let the patient know, just, for security reasons and for privacy reasons, just let them know, hey, I'm recording this session here on my computer. It's for a tool that I have when it comes to note taking. But it also works for, in-person and virtual meetings. It works through your microphone. That is correct, Louis. You can also use dictation, or if you even have a recording from a previous session before you even signed up for Carepatron that you want to transcribe into the system and then turn into a note, you can also upload that file. So let's come over here to client, and let's generate a new note here. This is what I mean. You can go ahead and upload an audio file or even you know, an MP4 file right into the system, and it'll transcribe it for you, and then you can go ahead and move it over to a note directly within the system as well. Alrighty, team. So we're right at the end. Again, thank you so much for joining us today. If you guys have any remaining questions here, I see one from Lydia and Yvonne. Okay, counselors, is there a package that often? Okay, so regarding billing, Lydia, we charge per user. So when you sign up a new team member to the system, that's the only charge you're going to get. There's no fees or charges for the amount of clients that they're assigned, or the amount of services that they are assigned, you know, or notes that they can create. There's no extra fees or charges for that. It's just the sign up fee. Yeah, of course, Yvonne. So let's come back to the client, and again, just choose the client, click note. From here, you have the AI Scribe feature. We can go ahead and start transcribing, or as Louis said, use dictation. If it's just you and you want to be able to add information, the system will understand it's just a single-way conversation. When it comes to transcription, it'll understand it's more of a two-way conversation where it also needs to take the client's audio into account. Okay, but you can start transcribing from here. And also, outside of the AI feature, the notes are very complete in and of itself, where you can go ahead and add a lot of pieces of information in it, like you would be able to do on like Microsoft Word or, you know, Google Documents and stuff like that. You can go ahead and do that directly from here. But you have the added bonus of our form fields and smart data chips that make creating the templates or the notes a lot easier. Okay, so if you want to create a format for a note, like a session note, we have these right here. But if you want to make sure you have information from the client pulled directly from their profile, so you don't have to write it again, you can just go ahead and add the client's first name and last name. And there we go. So
And
it automatically
Marco,
has that info.
Can I just ask quickly, in the client portal, can they use that notes as a message feature? And then is the message logged per date? Or is it a running log?
So the message in the documentation section, you're going to see the date when it was last modified. But one thing I recommend doing, because you can definitely use a note as a way to communicate with the client within the workspace. One thing I recommend doing is just when they're writing a message, ask them to write down the date as well, just to make it even clearer. Okay, because they might have changed something, like they might have noticed they had a typo the day after they wrote down the note, and the system is going to think it was, you know, edited last time or created.
So it's a running note. It's not.
Yes.
Okay.
Yep.
Thank you.
By split screen, Jay, do you mean like at the time of having a call, or more just like in the day-to-day? Because I'm also using a split screen here, guys. I have you guys over here to my right, and I have the system over here to my left. So you might have noticed I'm turning around when I look over here.
So I often have the, like I might have the intake paperwork up and a note, so that
Gotcha.
I'm looking at the intake paperwork and looking at a note. And I found that very challenging. So I'm wondering if there's a way to, because it, like where the note is, I couldn't move it to put it on a different screen, so I could type from that and look
Gotcha.
at, is that a feature? Is that a way to, is there a way to do that? Thank you.
Yeah, of course. Thank you so much for the question. So it's not exactly a feature, but it's kind of a workaround where you could just open another window of the workspace, you know, and do that directly from there. However, I do take your comment as great feedback, because I think it would be great for you guys to be able to see all the notes or templates that have already been created as you need to, as well as have that quick access to notes as you would, you know, anywhere else within the workspace, where if like you generate a note directly from an event over here,
Right.
you could just minimize it and, you know, take a look at the information and maybe just like, or split the screen between the two
Right.
pieces of information.
Because sometimes I'm working from like several different, like Yvonne, who's had great questions, was talking about that ongoing note. So you might be commenting on the ongoing note in your actual visit.
Mm-hmm.
And I was wondering if it's possible to do that. Can you show me this, can you show me your workaround? Just to make my life a little easier until maybe that's a little different.
Of course, for sure. Give me one quick sec. So what I'm saying is just open up 2 windows of, give me one quick sec. Let me change my screen sharing options so you guys can see exactly what I mean. You can see my full screen. Alrighty, guys. So you can see I have 2 tabs here, both for the same workspace. So the workaround that you have right now is just like being able to do a split screen like this and open up the client archives right here, documents and intake forms that you need. So let's say we need to take a look at this form here. And there you have the information. And you can work on, you can use a template here as well if you want to. Like,
I'm sorry. So I would be able to open one on one screen and one on the other, because I frequently just have people read the notes alongside me. So so they know exactly what's going on. Like, I don't need to, I'm not mental health. I don't need to screen things.
yeah.
So so I could essentially then just screen share one screen over the other. That's the other thing, screen share. Maybe that's not part of today. Is there a way to learn about screen sharing?
For sure. Let's go ahead and start a quick call over here, guys. Let's close this. Let's actually start the call for this right here. Let's give it a quick second to start the meeting. There I am. And join now. So here we are. And now I can share my screen directly from here. And you can choose, as you can see here.
Oh, I can choose. Okay.
Like you would here on Google Meet. Like the way that we designed our telehealth feature is very similar to all the features that are already available, just to make sure you guys don't feel like you need to learn a new language, kind of. So you just come in here and you can choose a tab in your browser, an entire window, or even the entire screen as I'm doing right now.
Yeah, I didn't get that option. Okay, I'll have to try that again.
For sure.
That's fine.
And again, if you have any questions, use that the help center, let us know. Or if you find a bug that tells you like you're not able to go in there, it's infinitely, loading up or anything, use that help center, let us know, and we'll take a look at it for you. Okay. Alrighty. Awesome, team. Of course, Lydia, reach out through the help center and we'll make sure to send you a link to where you can go ahead and schedule an appointment with somebody from our team so we can talk to one-on-one. Okay. Alrighty, team. Again, thank you so much for being here. That is the end of today's webinar. If you need any assistance moving forward, reach out through the help center. We'll be happy to help you guys through there. You also have a bunch of articles available to you right here already. Those are available 24/7. So if you ever need to take a look at how our system works or are curious to know what other features are available, always take a look at the search for help option right here. Our system is available, like I said, 24/7. And our team is always here to answer a question. Might take us a bit of time sometimes, but we're always there to provide the assistance that you need. Thank you guys so much. Remember, you're going to receive a recording of today's webinar tomorrow. Once it becomes available, be on the lookout for that email. If you ever need to reference this webinar again, you'll have that resource available. But if you have any questions about themes that we talked about today, anything we covered, Help Center is right there. We'll be happy to provide that assistance, okay? Alrighty, team. Thank you guys so much. Have an amazing rest of your week. It's great to have you guys here. It's been my pleasure. Take care. Bye-bye.